اليوم قديش في الشهر؟ 28/2. ماشي اوكي بلش.
مشكلة تراها تمشي الطيب يرجع علم النفس
السلام عليكم ورحمة الله. أهلا فيكم في السكند سمستر. أوكي. وإن شاء الله اليوم نقول لكم باي باي، راح تخلصوا من البيسك وتروحوا للكلينيك. ممكن تجوا للأمام بليز كلكم بلا زحمة. تعالوا. أيوة بليز كلكم بلا زحمة. الحمد لله هلا أنتم عددكم كويس لا بس لا تعملوها زي المرة السابقة. within that time يقول شنو؟ طيب بالفصل الأول كنا جايين للوينتر فأكيد تتقوص المواد بالبرد، بس هلا جايين بالسمر تتمدد. يعني هلا انتوا هيك ان شاء الله next time تكونوا اهدى. اوكي. Our subject in this semester رجعنا ثاني. Okay. Occupation, health. This lecture is going to be provided by Mashallah. Okay, this lecture is going to be provided by me and Dr. Khalid Watson.
So
as you know, as everybody knows, that millions of workers were exposed to chemical substances or to any other hazard during their work. So this hazard, we call it occupational hazard. Exposure to occupational hazard will result in a very, very serious condition. Very serious. This condition is ranging from communicable disease to the malignancy. We will discuss it later on. But fortunately, the most of these hazards are distinguished, having a distinguished feature that it can be recognized. So, as long as we recognize, it means we can do something for the worker. In another word, we can detect the health profession. When I say we, of course, me and you, the health profession can recognize these hazards. as long as we recognize the hazard in another way, we can do prevention for it. Okay, we can avoid it as much as possible. So this is the bright feature or bright picture of the occupational hazard. Although it causes a lot of diseases, different serious diseases. So we can take appropriate measure to prevent these hazards. Occupational hazard, occupational health is concerned with the effect, of course, of work on the health of the worker. In any place, whatever it's, when we say worker, it's not but a man, even us, even you. Okay? So it concerns with the effect of work on the health of the worker. So that it can be defined, the definition, it is a science devoted to the recognition, just now I said, evaluation and control of the workplace hazard. That this hazard that causing either sickness, impairment, or even disability of the worker. So this, you remember, we already mentioned this in the first, okay? Or disability of the employees or worker, it doesn't matter, in the community. The health of the worker has a several determinant, of course, as any health has several determinants, including the hazard that he or she be exposed at their workplace, including the risk factor or hazard that being exposed at a workplace. As I mentioned just a few minutes ago, these hazards causing a lot of this. It can cause malignancy. A lot of malignancy occur as a result of workplace. Accident, musculoskeletal disease, communicable disease, even psychological disease. There is a depression, okay, work-related stress or work-related depression. We will discuss it in the coming lecture, inshallah. So, occupational health as a health, it is defined by the International Labour Office, ILO, is International Labour Office, and as defined by the WHO in 1950. What's the definition of health, occupational health? The promotion and maintenance. Look, promotion and maintenance of the highest degree of the health of physical, mental, and social well-being of the worker. So you can see it is the same definition of the health. It is complete physical, mental, and social well-being. So physical, mental, and social being of the worker in all occupation. So it's promotion. So they are concerned more in promotion. In another word, yes, they concern more in primary prevention. Promotion the health. Yes, we are healthy, but we are concerned to promote this health or maintain. Okay. Promotion and maintenance of the highest degree of the physical, mental, and social well-being of the worker. This is the definition given by WHO and ILO. Okay. So this definition, as your colleague mentioned, emphasized in terms of health rather than disease. We are always looking for health more than looking for a disease. So according to the definition of WHO, occupational health deal with the aspect of health and safety. With the health and safety at the workplace. والله ما بعرف. And it is focused, as she mentioned, on the primary prevention. You remember. So it combined both occupational disease and occupational hygiene. We are going to discuss this. For everything there is a history. Let us see what's the history. أنا أعرف أنتم موجود من الhistory, but you should know it. Okay, occupational health or occupation is not a new. It is very, very, very old. They found, for example, Egyptian papyrus that in 1600 BC, they found there was a description about the pain that came as a result of the work strain. So it is a work disease, work-related disease. A pain resulted from the strain at the work. This is 1600 BC. Okay. Also Hippocrates, 460, he said, when you ask a patient, you should ask him about the pain and the source of the pain and the duration of the pain. So always he put in his mind that there is a relation with the work. Coming to the Middle Age, you know what's the Middle Age and Renaissance, okay, القرون الوسطى. Several medical articles were written on the hazard of mining and smelting. المناجم Coming to the modern era, the modern era of occupational disease was started at the beginning of 1700. بداية 1700. 1700 early. One of the هذا you should know it. One of the greatest pioneer in the occupational disease. He is an Italian physician, Bernardino Ramazzini. Okay. What this physician did. This physician also they consider him as a father of occupational medicine. He wrote a very comprehensive textbook about the occupational disease and medicine. He said it is not enough to ask the patient about the pain and the duration and so on, as Hippocrates said, but we have to ask him or her about the occupation, about his work, okay, and the type of his work. So he described, he said, I may venture to add one more question. What occupation does follow this patient? Okay. And this physician described many occupational illness that's still considering here nowadays all over the world, describing. And also he described some principle method for controlling or for preventing of these diseases. Still we are using it, although it's very, very long time. And also he convicted a lack of ventilation and unsuitable temperature. شاف انه temperature ventilation is not good for some of the work. And also what he did, he urged laborer in a dusty trade to work in a very big place, to work in a large and well-ventilated room. Not only that, what he added, he said that when the worker working for a long period of time, they should have a rest of time between the work. So he recommended rest interval in prolonged work. Moreover, he said the worker should have exercise, physical exercise, and the posture should be good, okay, healthy. So all these we are using it today. Then another, this is Italian, and another Charles Ranker. He is an English. Also, he wrote a first book in English. During that time, what happened? There is so many legislation were appeared. So this legislation, okay, extensive legislation was being brought it into British. And one of these legislation to protect the health of the worker. And also this legislation related to the child labor, عمالة الأطفال, okay, prohibited from that time. And protect public health at time of profuse pollution and cheating food. So it's not only for the work, outside the work, protect all the community from cheating food and also from profuse pollution. In 1914, there is a term, they call it worker compensation, تعويض العمال أو تعويض أي موظف مش مشكلة. This started first of all in the German and then Canada started take it later on to compensate the worker. One of the major events that profoundly influenced the shape and development of occupational disease, what was this event? Is the Industrial Revolution, الثورة الصناعية. What happened in this Industrial Revolution? Of course, most of the factory they have implemented in the urban area. Okay, so there is moving of the worker from their place to the urban, hijra. So what happened? This revolution affect the community as a whole, and affect the family or the person, him or herself, particularly himself at that time. So it affects within the community and also it affects the individual worker by himself. How it affects the community? Of course, there is overcrowding, the housing is not good, sanitation is become bad because of overcrowding, and so many things in addition to the pollution. From the other side, how it affects the individual or his or her family, particularly his family. Of course, the man will leave his family and goes to the workplace. So in this case, okay, he will be exposed to psychological factor. And also what happened? He will go to the alcoholism. Alcoholism was increased and prostitution increased. The man left his family. So all these things and poverty. ايش يعني prostitution؟ ينطوها name work, sex worker ينطوها. Okay. So all these as a result of industrial revolution affect both the community as well as the individual and his family. Now, what's occupational disease? This health, we said, is promotion and maintenance of the highest as a health. But what's the disease? Okay. It's a disease that occurred as a result of exposure to a specific causative agent. There should be a specific causative agent at a workplace. This agent is fully established, موجود. أنا صار لي كذا من وراء الشغل مالي. أوكي، لازم أروح للمعمل وأشوف صدق موجود هذا causative agent or not. Okay, so this agent has been fully established or fully recognized. Not only that, it can be identified and can be measured because there is a level in order to affect, so it can be measured, this factor, and eventually controlled. من البداية قلنا can be controlled. When I recognize it, I can control it. So this is the definition of the disease. It is a disease that caused by a specific causative agent at a workplace, and this agent should be recognized, should be identified, should be measured, should be okay in a level and controlled. So many diseases we are going to mention it, inshallah, silicosis, brucellosis, and so on. Occupational disease, they are a group of diseases which arise out of and during the course of employment, definitely. Arise out of or during the course of employment and causes present in occupation. And this cause is present, as mentioned, it should be present in the factory. So there must be specific factor or substance in the workplace exposed to which causing the disease. أنا من ورا الديزيز طيب مني أروح للمعمل أشوف موجود الديزيز. Okay, should be present. This causes should be present in the occupation place. The symptom and sign often present and appear when the worker in the job, or maybe later. هلا نشوف كيف maybe later. So many diseases. So many diseases may be later after. So now this is the occupational disease. The same definition just now we mentioned. It is a disease arising out of or during the course of the employment, طبعا, as a result of it or during. Its causes present. The causative agent should be present in the workplace. It's the same in the occupation. Why do we have to diagnose the occupation disease? Why? It's important. It is important to know that this disease is occupational, because there is a lot of diseases, not occupation. So why? Why it is important? First of all, the worker has a right to receive medical care at the expense of the employer. فمثلا عنده حق أنه يعالج على الemployer. Okay? شو ترجمة employer؟ اللي وظفوه. Okay. This is one. And also, he have a right to have a paid sick leave. ياخذ sick leave مع قطع من راتبه. Okay. In addition, in some disease, the worker will get disabled or handicapped as a result of the hazard in the occupation. So in this case, he had the right for compensation للتعويض. Just a few minutes we said دخل التعويض بال 1914. So all these are important for the worker. يحفظون حق الworkers. What are the characteristics of occupational disease? This is very important to know. This disease is occupational or not. Of course, so many diseases. The sign and symptom, it doesn't differ from the non-occupational disease. It doesn't differ. The clinical and pathological presentation of occupational disease is not differ from non-occupational disease. Okay. Occupational disease may occur after termination of exposure. This happen a lot of time. بعد ما يطلع تقاعد شوفوا صار عنده disease. That's why it is important to ask the patient the current occupation as well as previous occupation. It is very, very, very important. So after termination of exposure, best example in asbestos-related mesothelioma. This is a malignant disease related to the asbestos. It takes to appear at least 20 to 40 years after exposure. So in this case, the patient or the worker already retired, or he may left the work in which he was in. Some form of occupational asthma manifest at night. طيب أنا بالنهار ما عندي، بس من أرجع بالليل الأسمة. It is due to the occupation, okay? Not necessarily أنه الساين symptom بتكون بالplace of occupation, no. من أرجع البيت يلا يطلع. The clinical manifestation of occupational disease can vary with the dose. The effect مالها affect certain organ when the dose is high, and while it affect another system when the dose is low. Best example أن elemental mercury, exposure to the elemental mercury, when it is in a high concentration, it causes lung failure. But in a low concentration, I mean exposure to a low concentration to elemental mercury, it affects the central and peripheral nervous system. So also this is very important. That's why just now we said we have to go and measure the causative agent in that, because that symptom is different. This is another characteristic. Moreover, occupational factor can act in a combination with the non-occupational factor and causes also a serious disease. The best example is what happened between exposure to the asbestos and smoking, and in causing the lung cancer. Exposure to asbestos alone, without smoking, lung cancer will be 5 times more than non-exposed person. تذكروا الأودس ريشيو والريلاتيف ريشيو إن شاء الله نسيتوها. Okay, 5 times more exposure to asbestos alone. Exposure to the smoking alone, 10 to 20 times than non-exposed person. When we say this for, it means compare it to the non-exposed. While exposure for both asbestos and smoking at the same time, يعني الوركر لما هو يدخن بنص المعمل وهو exposed to asbestos, in this case 50 to 70 times more lung cancer will occur. So it's very serious when combination with the other non-occupational factor. Occupational disease develop many months or years after exposure. Just now we mentioned, and we say best example is mesothelioma. Okay, 20 to 40 years after exposure. Moreover, we said that the occupational disease clinical feature resembling the non-occupational disease. Specimens the same clinical, or the other things are the same. So this information about incidence and distribution of this disease is incomplete. Okay, incomplete. It is underestimated. The prevalence of most of occupational disease is underestimated. Okay. Why? Because it's resembled. اسمع خلاص ما راح تسأل ولا تتقصى عن الاكسبوجر بالورك. اوكي انا اشتغل بفلان نعمل that's all. But you have to ask specifically for the exposure substances. For this reason, most of exposure are often overlooked. تهمل أو ignored أو ما تأخذ بالمعيار. Or misdiagnosed and undercounted, or we said underestimate. So, for that reason, because it's underestimated and we don't know that. From the beginning, we said when we know the causative factor, we can control it, we can avoid it. So for that reason, all the adult physicians اللي هم أنتم منهم, okay, that's why we give you a lecture about the occupational disease. All the physicians dealing with the adult should have some concern about occupational disease. لازم دائما يخلي باله occupational disease, whether in treatment or diagnosis. Okay. Not only for that, because it's resembling the non-occupational, but why? Because occupational disease affect many organs in the body. Just now we say different level or concentration it affect. So it affect many organs. And also it causes unrecognized disease after retirement. خلاص صار له 10 سنوات هو طالع عن معاش. ابتدت الساين and symptom. So it occurs after retirement. So that's why. Okay. So it may cause unrecognized disease after retirement of the patient. And also, occasionally it affects the family member. هو بالمعمل ملابسه كلها okay بها material وين يروح البيت also so affect the number. And in addition, many chemical exposure are brought home unintentionally or associated with the reproductive toxicity. واحنا نشوف انه congenital anomaly وما من الاسوالف اللي تطلع هي due to exposure of the worker. Some of them, طبعا not all, due to the exposure of the person at his work. Now coming to the main element, two main elements, four elements are present in definition of occupation. What are these two main elements? Causal relationship, خلاص. Definitely when there is a cause, risk factor, and the fact you remember, and this disease occur as a result of this exposure to this material. Good, very good. We will discuss. Okay. Good temporal sequence, yes. So there is a strong causal relationship between the outcome and exposure and specific disease. And also the disease that occur among exposed among worker, the morbidity is much higher than the disease occur among the non-worker. Just now that شفتوا مع الأسبستوس في السيجارة. So it occurs more than the other population. Other population, yes, they have, but the morbidity or the prevalence or incidence, whatever, I am sure you know what do we mean by morbidity. It is much higher among those exposed at work. This is the two elements, causal relationship and the prevalence or incidence of the disease, or the frequency of the disease among workers is much higher than the rest of the population. This is the two elements. Now, what are the general criteria for identification and recognition of the general? That one is just two elements, important, but the strength association between exposed and risk factor, exposed and outcome, sorry. A great and impact of exposure on the occurrence or development of disease. So there is a causal relationship, just now we mentioned it. Consistency, I mean, the other, not only this worker, so the other worker also having the same symptom. So there is a consistency, coherence, okay? Or in another area or in another country, the same exposure would cause the same disease, okay? So there is a consistency or coherence. Temporality, okay, or time sequence. دائما the outcome come after exposure. The disease come after exposing to the risk factor. So this is what we call it, temporality or time sequence. This is also the general criteria. Biological grading, greater level of exposure will cause severe disease or different disease. Just now we mentioned regarding the elemental mercury and lung cancer or affect the specificity. Exposure to specific risk factor result clearly defined pattern of disease. Specific factor, okay, causing a specific disease. Interventional studies, what do we mean by this? إنه لو الوركر إن طلعته خارج he get well, it means the cause is from the factor. ولما أرجع again للمعمل he get the same disease, so it means the cause. So this is what do we call it? Interventional studies. Sometimes primary prevention trial might verify whether removing a specific hazard or reducing the risk of exposure. So here in the environment will lead to the eliminate the disease again or reduce it at least. So this is what we call it intervention تداخل. إنه أسكر اللي يجيني من يمي أشوف الديزيز كامل. أوكي. أو الوركر أطلع برا أنطيه جلسة أشوفه صار كويس. So this is what we call it interventional study. تداخل. Now there is another term we call it work-related disease. That one is occupational disease or work disease. But this one, work-related disease. It's not a disease from the occupation. It is the disease that aggravated by the occupation. And diabetes. Okay? But because of the okay? But because of the stress in which I am living, okay, so my diabetes will be increased, okay, or will be complicated, or I have something in my heart. But as a result of exposure to this work, okay, I will get some complications.
بشكل غير مباشر.
بالضبط. يعني الديزيز موجود but aggravated, accelerated, يزيد, okay? This is what you will call it, please. Let's نشوف it. Okay. It is that aggravated or exacerbated by a work exposure. Bronchial asthma. كان عندي bronchial asthma. بس حطوني في work place اللي exposed. Okay. فراح يصير aggravated. Or any other, or heart attack. Work-related some disease are not typically caused by exposure. فإذا الكوزاتيف ايجنت مش الكوز اللي صار بي مش due to the work. أنا عندي history of diabetes, family history. I am مستعدة at any time أن يصير بي. But لما خلوني بالwork طلع لي diabetes. So it is not due to specific factor in the workplace, but it is aggravated or exacerbated. So they aggravated by occupational stress. So they affect all people. مش اللي أنا جزء يودوني بغير ما أعمل بس برضه سلبية. Let us see the difference between the two. So we have two terms. We have occupational disease, or work disease, and we have work-related disease. What's the difference? Work-related disease and occupational disease. occur largely in the community. كل العالم يصير بها diabetes. كل العالم يصير بها heart disease. Here, it occurs mainly among the worker in the workplace, in occupational disease. Okay. Multifactorial origin, diabetes مليون ألف factor. But occupational disease, specific factor. It is specific to that factor. You remember me saying. Okay. Another, exposure to workplace may be a factor. Here, exposure to workplace is essential. إذا ماكو هذا الفاكتور أنا ما بيصير بيا، إذا ماكو asbestosis أنا ما بيصير بيا asbestosis. Should be. It is essential. While that one could be a factor. Second. Sorry. Another thing. Maybe notifiable. And maybe compensatable. ممكن يعوض. ممكن. But occupational disease, it should be compensatable. لازم يعوض الworker. شايفين? These are the difference between the two. Occupational medicine, as mentioned by the Royal College, occupational medicine, it's preliminary branch of preventive medicine. احنا دائما preventive exercise. Okay, from the beginning we say it is preventive, whatever the type of the preventive, but mainly primary, with some therapeutic function. Occupational disease deal with health problem of the worker at the workplace, definitely disease. Work environment, it's not only about the worker, also it deal with the environment of the workplace. Whatever the environment of the workplace is, and adverse effect of the worker. Moreover, health promotion for a worker and proper prevention and treatment, this is the work. Now just يمكن هذا آخر slide. Please, ممكن شوي. Okay, the difference between occupational medicine and clinical medicine. A target group بالoccupational medicine definitely هم الworker. Whatever the worker. حتى هنا it is the worker من A to Z. Okay. Here patient. إذا ما عندي patient I am dealing with مفهوم in clinical. So worker in all jobs healthy. Health status healthy and disease بالاoccupation اثنين. بس بالمستشفى ما شوف غير disease. تمام. Only the disease person. Clinical medicine. The place, plant, the factories. While in clinical medicine, of course, the hospital and the clinical and other clinics. A diagnosis system of medical examination, لأنه on the specific system. Okay. Here, examination and investigation. من أجل الفحص. بينما ذاك أكثر. Management. Who will do management? Okay. Here, management is medical and surgical, definitely, but clinical medicine, but in occupation medicine, occupation health program. There is occupation health program that deal with the disease, or not only disease, even healthy person. Okay, worker for prevention and disease. And thank you. نبتدي إن شاء الله occupational program. that's why أنا خليته بالأخير حتى أي سؤال رجاء؟ أوكي ممكن الأوراق بليز.
دكتورة ايوه
أي سؤال؟ وقفيها.
ايوه دكتورة.
This is not mine. It's not mine.